Ajayi live. Today is a special one because I have with me Hajia Saratu Kassim. And yes, I said I have with me, though she's not physically here with me. I'm in Lagos and she's in Abuja. Thanks to technology, she will be, we'll be discussing about infertility today. And I think it's something I've been looking forward to have this kind of interaction with Hajia Saratu Kassim, who has been doing a lot of work in this space, trying to educate people about infertility. So hi, Hajia, how are you doing today?
Good afternoon, sir. I'm fine, thank you, sir. And you?
Yeah, I'm good. Good to see you. Yeah, so good to see you. Yeah, I know that your volume, or is it my volume that is still, I can't hear you properly. Maybe my volume, I need to adjust my volume.
Okay.
Oh yeah, it's my volume, yeah. Okay, I think I can hear you now.
Okay, sir.
Yeah, great. So, tell us a little bit about yourself before we start. So people will know when I say you've been doing some things about in this space. Because I'm going to hand over the program to you.
It's so good to be here. And today I just want to say everything that that could go wrong had actually gone wrong. But I said I was going to be here no matter what, because for me this is my passion and this is what I love to do. And I actually planned for today to talk about my own experience with IVF, but unfortunately I had one or two technical issues, so I couldn't actually prepare better. But notwithstanding, it's fine. These things happened. My name is Saratu Kassim. I am the founder of Fertility Support Group Africa, and what I do regarding infertility was something I was born to do, because some of us go through these challenges without knowing why we're going through them. And I knew later on that God wanted me to go through this so that I could help lots of women and touch lives regarding this. Because I know if I had not gone through what I had gone through, I won't be here today doing what I love to do. So thank you so much. It's going to be an interactive and interesting section by the grace of God. Thank you.
Great. Yeah, so we're talking about when the cycle fails. So, well, maybe I just let you, just like you said that you've been through this. So, I think it's better if you, because one of the things that we physicians miss is the perspective of the patient, okay? Until the two come together.
Yeah.
Yeah, because there's a software, there's a hardware. Okay, and until the two come together, you don't have a whole piece. So maybe I just let you lead this so that we come from the point of view of a patient or a client, as we say in IVF.
Okay. Yes, sir. We're going to do it together because we as clients also have lots of questions for you, doctor. So it's going to be interactive for both of us, because I also have personal questions that I've been meaning to ask.
Wonderful. I'll try.
So it's going to be both ways for us. But before I even go through the questions, I remember when I had my own procedure and it didn't fail per se. I tested positive. Then a week later, I started bleeding. So there was nothing in the uterus and everything. So I kept wondering what went wrong, because I was young. There was no issue. I had no fibroid, and everything was okay for me. I did the IVF at an early age, in my early 20s, and no uterine fibroid, nothing in the uterus, no hormonal issue. So for me, it was like, what went wrong? So doctor, please, can you please at least help me from there?
Okay, I guess I need to put on the soothsayer's hat in order to be able to do that. I was just kidding. Now, when you said that it did not fail, actually, why do we do IVF? We do IVF to have baby or babies. Immediately we don't have that, it has not succeeded.
Yeah.
Okay, so I think that failed. All right? Now, there are different ways in which
Yes, sir.
IVF fails. Okay. But let's say, but before we get to that, let's probably look at the back of the book. One good thing that is probably going to help shaping this discussion is that around, I think, June, July, in the UK, HFEA released the figures for 2018 of all the clinics in the UK doing IVF, all right? And what they saw was that the baby take-home rate for the whole UK was about 23%, all right? Wow. And they saw that for people less than 35, it was about 31% per embryo transfer that you take a baby home. Okay, and that decreased with the age. But for 35 to 37, it was about 25%. For 38 to 39, it was about 19%. And then for people over 40 to 40, between 40 and 42, about 11%. For over 43, less than 5%. So we need to understand the technology itself to start with. Yeah. Right? So that, because most of the time our expectations are not real. Whether you don't have fibroids, everything is okay, if you do IVF, all right? Because don't forget what we said is the successful story in IVF is that you must have a baby. That's when it's successful, all right? Yes, sir. So whether you have, everything is okay, it's not going to be 100% that you carry a baby home, even if you are 25, all right? So and all the figures all over the world have shown us that even, okay, there's enough figures released in Australia that show that if you are less than 30, if you do only one cycle, the chances that you take a baby home is about 44%. So we need to understand it to start with. And why, that's probably one of the things we need to address. Why does it fail? Just like you said, that there was nothing, everything was okay, tip-top shape, but still you didn't have a baby from this treatment. All right. So we need to understand how the technology works, and then that's when we'll be able to know why it sometimes fails. What I say sometimes again is that what we expect from IVF is like we buy a new car and we expect the car to be flying. You know, the technology was not made for a car was not supposed to fly. So if you are expecting 100% from IVF, it's like that. And then some people also, they come to me and say, oh, my treatment succeeded because I had a positive pregnancy test. No, that is not the essence of you doing IVF. As long as there is no baby, especially when they do a scan, there is no baby, that's not a success. That is not even clinical pregnancy. That's just a biochemical pregnancy. And let me shock you. I could even give you an injection now and tell you to go and do a pregnancy test and it'll be positive. So that does not count as success at all in IVF. So having a positive pregnancy test is really not the reason why people do IVF. So I hope that explains that first before we go into why.
Yes, sir. You actually made a good point, because I've been trying to raise this issue of biochemical pregnancies, and a lot of people taking HCG injection post ovulation, transfer, and they take it some days to their test and they have a positive pregnancy, which eventually it's not an actual pregnancy. It's because of the HCG shots that has been given to them as a result of the procedure. So I actually got that.
I think Hajia has frozen. Okay, but please kindly like and share this so that other people can also get to hear about what we're discussing. Let me take also while she's trying to until she gets back, maybe I'll better take this question. Kindly assist, I was diagnosed. Oh, I think she's back. We'll get back to the question later. Yeah, Hajia, you're back.
Yes, I'm back. I've been here.
Okay, so please, go on. You were
I was talking about an instance of ovarian hyperstimulation when somebody does IVF. And I get questions from people, should I go ahead with the transfer or should I wait until after, I should freeze the embryo until after I am ready?
But you see, there's one good thing about IVF that has happened in the last couple of years. And that is this freezing, all right? Now we can freeze eggs, we can freeze embryos with very good results, okay? But what we say sometimes is that in medicine, unless there's an indication for a procedure, you might not need to do it, okay?
Okay.
But not also psychologically being ready might be a reason for you not want to, if you know you are not ready for the transfer, fine, it's okay. We can do it, we can. But you know, maybe as we go on also, we'll see that freezing also is a science, and you need a good laboratory for you to be able to do that as well. So, and that's one of the things I say to people, that you see, very few things is within the control of the doctor for success in IVF. But the most important thing that is within the control of the doctor, or maybe two things, is the quality of the laboratory, the experience of the people working in the laboratory, the equipment that they have available to them, and the experience of the doctor who is going to do your transfer. Those are the only things that humanly we have control of. And so you must be able to choose the kind of clinic that can have those things. The doctor must have enough experience, okay? And then the embryologist must have enough experience, and they must have good technology. And part of what we are talking about is this freezing comes also with some experience. So if there's a reason for the freezing, and there's two clear indications for freezing, okay? When you are...
Okay.
Yeah.
So it's better for you. It's better for you, actually, in other words, to just go ahead with the procedure and manage it rather than freezing because of other issues that could arise from freezing as well.
No, I did not say that. Seriously, the results that we're getting, you see, that experienced laboratories are getting from freezing. Pregnancy rate is even better than we think. The figures are, you know, in science, you have to, it's not one experience that you use. You have to, everybody has to agree that this thing is like this. The initial experience that we're having from freezing in very good laboratories even seem to be better in terms of pregnancy rates, to be better than even you doing fresh transfer. But I've told you, it depends on the experience of the laboratory. It depends on the experience of the person doing the transfer. So, but that's a discussion you probably have to have with your doctor. And that's why I keep telling people that the most important decision you actually make when you are doing IVF is the choice of the clinic you are going to use.
Yeah. I actually say that a lot because the expertise of the person doing your transfer is not negotiable. It's something that the person has to know his onion, or else. And that's where we get it wrong at times with the so-called cheap centers and the rest. I'm not saying if a center is cheap, it doesn't mean it's not good. But I don't rate it as being excellent. The fact that it's cheap, that's the criteria. For me, the criteria is who is doing the transfer, the embryo transfer for you, because it is very, very important. And I've seen a lot of people, even from my own experience, when I started IVF, I thought it was 100%. I thought it was the final solution, and a lot of people did not know that, and they went into IVF with the same mindset I had then. And it was like, everybody's like, you want a baby, just go for the IVF, don't waste your time. And I had a 12 factor. So it was one thing that led me to, I had an ectopic pregnancy, so I lost 1 tube. The second tube was said to be blocked, and that was what led me for IVF. I didn't want to waste time doing try and error. So I decided to just go for the IVF, which I did. So I realized that most of us had these expectations. We didn't know about it because we thought it was a procedure that you just go and it's for sure. But and the good thing about the awareness centers is that a lot of people think they know, even if you're going through infertility, if you have not gone through IVF, you might not really understand the emotional roller coaster that has to do with that procedure. I tell people it's a different ball game entirely. I actually have a sister who has gone through 2 cycles and never had gotten to transfer stage. It's that painful. So for us that haven't gotten to failed, we even completed the procedure. So I didn't even see that part of it. And I was like, wow, mine was even better then. So it's really an emotional roller coaster. It's not something you want to gamble and just put your money, and something you want to make your research. You want to know who is doing it, what it entails. But unfortunately, I think these days centers don't carry patients along. You see so many things. They don't tell you how many embryos are gotten, how many frozen, how many they're transferring, how many. So you see people lost. When people ask me questions like, I did IVF and I'm going for transfer. Okay, how many frozen embryos do we have? They don't know. Maybe how many embryos do you even have at least, so that you know whether you freeze them or not. They don't know. And to me, it's like not fair. I think it's something that the person should be carried along. Did I do well? Did I not do well? What was the outcome of even the retrieval? So I think it's a very big issue. Please, I want you to say something about how do you do that in Nordica? Do you carry your patient? Do you tell them these things, or is not important for them to know?
Well, thank you so much. That is a very important question, and I'm surprised that anybody can go through IVF and not know what they're going through. So the drug that you are using, you must know. You must know the side effects of the drugs that you are using. Not to talk of how you are reacting to the process. Not to talk of you don't know how many eggs have been taken away from you. You don't know how many embryos you have. Then you are not doing IVF. See, that's what you said, the experience of the doctor alone. No, I added one thing. The doctor is important, the laboratory is important. The two must go hand in hand. Most of the time in Nigeria, maybe they go together. Maybe. But not necessarily. If I wanted to do IVF, I would want to inquire about how long the center has been working. How many patients have they treated? I want to know all that, not to talk of how many eggs you have had from me, you got from me. Of course, it's your right to know. You must know what is happening. And so when people don't even, and you see, you've been saying something about this emotional roller coaster, and sometimes it's difficult doing IVF in Nigeria because majority of our patients see reproductive medicine just like the malaria medicine. You know, some of the time before they finish talking, the doctor has prescribed and they're off. But in reproductive medicine, it's quite different. You need to know everything. So that, okay, I have a question. Somebody's asking a question that I can read now. She said, I'm in the process of IVF and I'm 47. What are my chances of having a baby? A success story. Now, this is a typical thing in Nigeria, you know. A 47-year-old comes to you and says, I want to use my eggs. And we have some unscrupulous doctors that will say they are pregnant using their eggs. So you see, it makes life so difficult because I just told you now, in the UK, they say if you are over 43, the chances that you have a baby is less than 5%. A 47-year-old using her own eggs is almost 0%. So these are and that's why I said the clinic, how you choose your clinic, what you know about the procedure itself. And that's why I like this kind of program. You must understand the procedure you are going into so that you know how it works. Okay, if you are 47, you cannot use your eggs. Except, don't let me blaspheme. So you can't use your eggs. And that's one of the things we need to get right. If you use your eggs, your chances are almost 0. So, and these are the decisions also that need to be made. And also, you can't make those decisions because some people go to the doctor and when the doctor starts talking about donor eggs to them, they just leave. They don't want to see the doctor anymore. They go to another place where they tell them what they want to hear. And so you see such people saying, because I'm interested in this person that you said has had two and has not gotten to the stage of transfer. You see, that's why when we started the discussion, I said IVF fails on different levels. Okay, that's one level of failure. That is like, is either the lab is wrong or the patient is making a wrong decision. Do you understand? When you have done 2 cycles and there are no transfers at all. So those are things that we also need to look at, like in Nigeria. So a lot, if there's any aspect of medicine where the buyer needs to beware, it's reproductive medicine.
Okay, so there's a question I got from somebody who was anonymous. I think she sent it with the registration then, and she wanted to know what can a woman in early 40s do to achieve a positive pregnancy result in IVF. Is there something that she can do in her early 40s to get a positive pregnancy?
Okay, I like telling stories. So, but this is not story. I'm going to play with figures. My story will be with figures. I'm going back to the HFEA figures again that I said was released.
Okay.
They saw that, like I told you, if you are above 43, that your chances is less than 5%. If you are 40 to 42, it's about 11%. All right. But one thing they also saw that only 18% of the patients in the UK over 40, only 18% agreed to use donor eggs. In other words, though donor eggs is what you need to, many people, especially when you're over 42, because between 40 and 42, your success is about 11%. That means, you might need to do many cycles. Some people are lucky. I've had a 43-year-old who had gone all over the world, had done in France, it has failed. She was doing a 10th cycle with me. Only 1 cycle she was successful. But that is pure mother luck because some other people have sweated and sweated and sweated. I just came to reap. You understand what I mean? Because success rate in IVF is cumulative. You need to do, especially when you're at that age, you need to do many. If you want to do few IVFs in your 40s, donor eggs is the easiest thing to give you results. But now there are some things that we can do for a woman that is in her 40s. She could do what we do call multiple cycles. Get eggs together. All right? Maybe 2, 3 cycles, bring them together. We could even do better than that. We could do what we call PGT, pre-implantation genetic testing. Because the problem why IVF fails in about 80% of the time is that the embryo is not viable, cannot become a baby. All right? In 20% of the time, is that the uterus is not good. And it's not only fibroid that does not make the uterus good. Maybe if we spend time a little bit on that, what makes an IVF cycle to be successful, all right? So like I said, in about 80% of the time, is the embryo that cannot become a baby. So there's a test that we call PGT, with which you can identify embryos that can become babies. Of course, it increases the cost of your IVF. For people, if you are going to be in your 40s and you're going to do IVF and you want to use your eggs, it's better that you do with it PGT, pre-implantation genetic testing, so that we are able to identify the embryos that can become babies. That will reduce your time to pregnancy. Okay, but for you to be able to do that, you need many embryos. And that is sometimes one of the problems that people
Okay.
in their 40s have. They don't make many embryos.
Okay, thank you. Okay. Doctor, there's a question here that says generally what is the success rate for, I think we've answered it because we've talked about the success. Is there anything you can do to improve your chances irrespective of your age? Because we've heard people talking about improving egg and sperm quality to help with the outcome of IVF. Is it true? How true is it?
Well, you can see me. You see I'm
Yes,
gray.
sir.
My hair is gray. Okay. Can I do something about it?
You can dye it.
Good. But does that change the fact that it's gray? If it grows back, what is it going to do?
No.
Good.
It's really great.
And that's what I said, at the beginning, that the success of IVF, only two things can the doctor control. The other factors is actually with the couple. The quality of the egg, the quality of the sperm, which determines the quality of the embryo if the laboratory is good. All right? You can, unfortunately, up to 2020, there is nothing proven that can improve the two. Proven. There are so many attempts to increase the two. What we can do in the lab is to try to choose the sperm, the best sperm, to fertilize the egg. But imagine that a man gives you, because what we forget is that what the man donates in fertilization is his DNA, which is in the sperm head. Okay. And that's why we're saying that if the DNA also is destroyed, there can be a problem with the embryo. So the whole dilemma of the embryologists in the laboratory is for them to be able to choose one normal sperm, one normal egg to get a normal embryo, which sometimes is a big headache. Because there's some men, all their sperm has problems. It is not from the looks, it is the genetic composition, the DNA they are bearing has a problem. For such, you're going to have a lot of problems getting their wives pregnant, even with IVF. And that's why we always talk about the age of the woman also, because that's the commonest reason why eggs have problems. Yes, there are some people who are young who have bad eggs, all right? But they're not in the majority. They're a small number. So the sperm and the egg, unfortunately, is what you bring to us. And for right now, yes, I see a lot of things on the internet, how to improve your eggs. You are in for a long thing. So that's the way it is. And that's why the ones that you can control, it's better that you control those things that you can control.
Okay. So there's a question. Jagada Yunis asks, what could stop the embryo from developing a week after implantation? I think we've answered. She said again, is there a specific?
Yeah, the commonest reason why both you have implantation failure and sometimes you have the embryos dying early on is because the DNA in the embryo is not good. The embryo is not able to become a baby. So and there is no drug that can do anything about that.
So it boils down to the quality of the embryo majorly.
Correct. And what forms the quality of the embryo? What makes up the quality of the embryo is the sperm and the egg and the laboratory where they come together.
What are the do's and don'ts after an embryo transfer? Is there something you're supposed to do or something you're not supposed to do after an embryo transfer?
Well, maybe the only thing that we might say you don't do is to have intercourse. Okay. But every other thing, what we tell people, it was in those days that they used to say, very early days of IVF, raise your leg, no. Live your normal life. That's all we say now. Live normally. If possible,
No 2 weeks wait.
Sorry?
No 2 weeks wait. No 2 weeks wait. You don't do bed rest for 2 weeks.
No bed rest. Why do you need to do bed rest? If you got pregnant on the bed, do you go and start taking bed rest for 2 weeks? And that's the thing. The body decides on whether it's going to take your embryo or not. Just like it happens when you have sex on the bed. It's the same. The moment the doctor has replaced the embryo back into the body, the procedure is the same. So you don't need to put your legs up. You don't need to have 2 weeks bed rest. We just say live your normal life. The only thing that, if possible, as much as possible, don't have intercourse.
Thank you, sir. And I have a particular question I wanted you to look at. And what will you do, what should one do after a failed IVF cycle?
The first thing is that one needs to be, well, you might need to do another one, because you don't forget we said that the reason why you do IVF in the first place is because you want to have a baby. And so if you have not had a baby, then you might need to do another one. But there's some things that you might need to put in place. The first thing is you need to take a look at why that failed. Okay. I know at that point in time you are angry, you are looking for somebody to blame. You might even blame your husband, you might blame yourself, you might blame the doctor. But seriously, that is not the right thing to do. Get as much support as you can get. And they're professional support, all right? Get as much support as you can get. Be able to look at what caused the failure, if you can, because sometimes also you cannot find out why it failed, okay? Because the tests that are necessary for you to do that sometimes might just be way too expensive or whatever. And then, but even if you find out, most of the time is that you need to do another cycle because you have not achieved what you wanted to do. So the thing is to go through with your doctor what can be done better the next time, if any, or it's just a matter of probability, and then you go for it.
Okay, thank you so much, sir. And in addition to what you said, I remembered coming back, having a failed pregnancy test after testing positive. I got back home. I was just fed up. I was angry, tired, and fed up. So I made different dishes for myself. I sat down there. I ate. I was full. I slept off. After eating, I slept there. And the next day, that day, I wasn't ready to face it or face the world or anything. I just wanted to rest. And then I slept and I woke up the next day feeling good, and I decided to okay, now it's time to go back to fertility. But then I think there's self-love and then pampering yourself. You've done your part. It's not in your hands. So blaming anybody wouldn't make any difference. But the thing is for you to look forward with a positive attitude and outlook. Take time to rest. Take time to show you've tried. It's not in your hands. It's God that gives. So you've done your part by going for the IVF in the first part, and you've done the necessary things. So you take time, reevaluate, reassess, and then go back to drawing board and start again. And by the grace of God, it will be successful. And there's this funny question I have here that it was funny. Is there a symptom for you? It was a Malala that asked this question. Is there a symptom for you to know if your IVF is going to fail, like a sign for you to know if the IVF is going to fail?
Well, that's another. You want me to be another soothsayer again? And this time I've run out of my soothsayer caps. You just have to wait. The tasting of the pudding is in the eating. You just have to wait for 2 weeks. Yeah.
Okay, thank you so much, sir. I think some of the questions here are repetitions, the do's and don'ts, and is there food to avoid after an IVF, maybe after transfer? Is there a particular food you shouldn't eat or fruits you shouldn't take?
Well, this thing about food and medicine, it's a little bit one way. Well, I'm not a dietitian. I don't claim to be one. I know people talk about eating pineapple around the time that most of these things are not proven. But if it works, it works. But I don't know what you can't eat or what you can eat. I think that's why we say live your life normally. Fruits are always good for anybody. So if you like fruits, be my guest. But food and your IVF, whether you eat or you eat a particular kind of food, I don't think that has been proven to either increase or decrease success rate. I have quite a number of questions.
Thank you so much. Most of the people.
I have quite a number.
I couldn't see the questions. So I don't know if you can.
Okay, maybe if you will,
Okay, sir.
I'll make sure I answer all of this. Maybe I answer them. I'll give them personal answers. Though I know some of the questions sometimes other people might benefit from the answers, but maybe we use them for the days that I'm doing Ask Me Anything, because there's so many questions here, and some of them are very, very interesting. Though some of the majority of them we've touched on them during the discussion. So, but I don't know. I think time is fast spent. That.
Sir, please, can you take one or two of those questions before we round up?
Okay, why not?
Okay, thank you, sir.
Yeah. That I'm trying to see which ones to pick. Okay. There's some that this morning it's like some of them are so. My team was to the process of whatever. Okay, good afternoon. I'm 35 years. Can anything be done to increase my egg quality? As the result shows that my egg reserve is low. I think we've answered that. How much does PGT cost? I think we've answered that. Okay. This is from Nkechi. She says, what age is the best time to do IVF for a successful outcome? The IVF can be done at any age. It depends on what the decision you are making. For example, we know that there are some 50-something-year-olds that have done IVF using donor eggs that have succeeded. But if you're going to use your eggs, you're better off before you are 40, maybe 40. After that, the success rate reduces drastically. And therefore, you might have to use donor eggs. Somebody is also asking, what's the maximum number of embryos that can be transferred per cycle? Right now, we've reduced the number of embryos that we transfer. We still use the age, because everything about reproduction is about age. So for people below 35, we don't want to transfer more than 2. Sometimes even 1, but not more than 2. And then for people in their 40s, maybe 3, if they are using their eggs. But if they are using donor eggs, we don't want to transfer more than 2 embryos. Please confirm if there is any medical treatment when IVF fails. No, there is none. It's either you are doing IVF once you have taken that path or not. Does removal of uterine polyp increase the chance of IVF success? Yes. Okay, I'm going to read this. This is from Adejoke Adeyemi. Why is it too expensive? Even the loans obtained result into another emotional pain when he pays for a common civil servant. Now, IVF, I think in Nigeria, people say it's expensive, but I really don't agree. If you're going to do IVF well in Nigeria, the people who also are practitioners, it's expensive. For example, Every of our clinic, we have 3 generators because light cannot go. We have a transformer from NEPA in each of our clinic. Then we have the inverter system also. That's only on power. Everything that we use, we have to import. So we are dependent on we're at the mercy of the dollar. So if you are going to do IVF properly, it's a little bit, and that's why if government can do it, maybe, but we all know that government has a lot on its plate now. This is another question that is very interesting. Is it a must that every first attempt of IVF must fail? No, that's not true. We have told you that some people will carry home babies even after one cycle. The only thing is that it's not 100%. So everybody should not be expecting to carry a baby home after one IVF cycle.
Sir, please let me ask a question briefly.
Sure.
This government support we just talked about, things are very hard right now, and we don't expect the government to actually come in 100%, even 50%. But at times when they ease the burden, or other bodies, not only governments, coming together to at least get people to assist other some couple who cannot afford this and is their last hope and last chance. In the States and other places, you see free IVF, maybe up to 3 cycles from the government. I know we are not in the same place, but right now, cancer days. But I think we also, in the fertility industry, we're not giving enough voice for government to even participate as much, to even come in. Because cancer, we did not, I think now is under NHIS, cancer treatment, some part of it. If the government can at least even just do 10%, it's something. Or even the testing, cover the testing prior to an IVF procedure. That would do a lot. Then you just pay for your IVF treatment. Isn't that something?
Do you want me to make a response to that? Well,
yes, I really.
The government, I don't think can step into it now because, until recently, we used to think that infertility is a personal problem, but we now know better that even the WHO has recognized it. But most of the time, for example, cancer, you have donor agencies aiding cancer. I've been trying to raise funds to build a big hospital. And anytime the people outside Nigeria hear fertility, they say, you people are too many. How should we promote that you become too many again? They are already afraid that you get. So, and that's why money is not likely to come for that. And so that's why it might be difficult for government to do that. But some of us individually, I know it's just a drop in the ocean, we give free IVF treatments, but that is just not enough at all. But, have we finished treating malaria, tuberculosis, those ones that don't even cost more than 150 naira,
It's a mental health issue. People commit suicide for that. People kill themselves. People die in silence for it. So
you are singing to the choir. You are preaching to the choir when it comes to that. I know that. But government has priority list, I'm sure. So it's probably not on the top of the list yet because of money.
So it's for us to start making noise now and getting attention by fire by force, even if it's something small we can get.
Sure, I guess so.
Oh,
pressure groups are always welcome. Pressure groups are always good.
We'll try. We keep trying our best.
Great. I wish you the best. If you need me for anything, I'll be willing to lend a voice.
I'll hold you to that, sir.
Yeah, but that's I just like you said, I know what women go through in this part of the world because we hold childbearing a very high premium in this part of the world. And so children women who don't have children, they are looked at in or let's say families that don't have children, they're looked at in a funny way in this part of the world. So anything that we can do to help is always welcome.
Thank you so much, sir. Thank you. We're grateful. And we hope to keep in touch and still continue to support. Like, the best we can do is to create awareness and try to bridge the gap. And we're doing that because you said something important. Knowledge is power. You need to know about the procedure you're going for, because we see dubious people, duping people, taking them for IUI and saying that is IVF. So if you don't even know about IVF, they'll do an IUI for you. You just think it is IVF. So we try to educate and create awareness regarding that, so that you really know what you're going for and make sure you get your money, the worth of your money. So, and we want to also thank you for taking the time to do this, because it's one thing for you to be a doctor and just do your thing in your clinic. It's another thing for you to be passionate about supporting people, doing the free treatment from time to time, even though it's a drop in, and I don't know, it might not be enough or seem insignificant, but it's something. It's not insignificant. It's still very, very important, and it's still useful. Thank you so much, sir. I don't know if you can still take one or two questions before we call it a wrap.
Oh, sure, I can. But let me just say that all the questions, I have about 34 questions here. All the questions on social media, we will attend to them. So expect the answers to your questions. If you still have more questions, you can send it to info@abayomiajayi.com and .ng. So I'll take all the questions, or you can send to Hajia Saratu too. They will get to me, and I'll answer all the questions. Yeah, so you can bring your questions on.
Okay.
No, Hajia, you can ask your questions. Or you want me to read two more questions?
Yes, but before then, miscarriage rate for IVF, is it the same?
It's the same. You know, I told you once we have replaced the embryo, it's the same process in the body. So the miscarriage rate is, well, maybe a little bit higher because sometimes of the fact that we have used sperm that has some problems. So the miscarriage rate in the population is about 11%. In IVF, it might be between 15% to 20%. So it's a little bit higher, but just like what you described the other time, you see some embryos stop developing. Yeah, maybe up to about 15%.
Thank you, sir.
Right. What is your experience with selective assisted hatching on embryos with fixed zonal pellucida in patients with repeated implantation failure? Yeah, this repeated implantation failure is a problem that we have. It's a topic on its own, because just like we said, it's either the embryo or the uterus, because those are the two things that interact in implantation. So with the embryo, you could do PGT just like we said, but with the uterus also there are some tests that can be done because we have seen now that the assumptions that we make in IVF is that when we bring the embryo out on day 3 and we replace into the endometrium on day 3, we're assuming that the embryo and the endometrium are developing at the same rate. All right, but we have seen that that only happens in about 70% of people. So there's a 30% where the endometrium is either faster or is slower. And so there's this test now that we're doing that we can do. That's what genetics have shown us. I mean, we're learning more about the IVF. That's what genetics has shown us now, that there are about 30%, 25 to 30% of the people where either they are faster or they're slower. And so we can recognize these people and transfer on the appropriate day. So for example, if the endometrium is 1 day ahead of the embryo, so what we know that even if we have a day 5 embryo, we are going to transfer on day 6. All right? The same way, or we can have a day 5 embryo and transfer on day 4 if the endometrium is, but you need to do the test to be able to do that. But laser hatching in that context was one of the first things that we first thought might be it. But evidences now might not really support that. We still use this archive, but really and truly, we cannot beat our chest from evidences to say that it will help in repeated implantation failure. Okay, good. When can we conclude to try IVF as an option? Yes, when a couple they've tried having a child, they have a regular intercourse for a time period of 1 year, then they should have an assessment. If the woman is less than 35, if the woman is more than 35, after trying for 6 months, they should have an assessment. And then, for example, if the sperm count is low, we can see what is causing the infertility, then IVF might just be what they need to do. If the tubes are blocked, IVF will be what they need to do. So I think the first thing is we should always tell people to have an adequate assessment. And doing scan alone is not adequate assessment for infertility, because that's most of the time, that's what we hear people just do. They say, I've done a scan and they said there is no problem. Okay. Then I have, Doc, if egg reduces in early 40, why the reduction in my own when I'm not 40? That's a wonderful question. Now, I'll still talk about this graying because it's supposed to be a sign of old age, isn't it? But you know that there's some 30-year-olds that are gray. So the same thing, some people, even in their 20s, they're called poor responders. They have poor ovarian reserve. So it is by identifying them that you can tell them what exactly they need to do. Because this person is asking me, if egg reduces in early 40, I did not say that anyway, because egg reduction starts from about 35. But why the reduction in my own when I'm not 40? So I'm sure that must have answered that. Oh, somebody is even still telling me that what is PGT? Okay, pre-implantation genetic testing. Sir, if one is over 50, what is the likely chance of success? Okay, and I know you said the egg of such a person cannot be viable, but sir, can one give it a trial? Sure, you can try. You can try anything, even if you are 50. But what I say is that sometimes, I'm sorry to use this, but it's like if you are 50 years old and you want to use your eggs, it's like you see a well and you carry your money and you go and drop it into it. When you know the success rate is less than 1%, why are you trying that? Do you understand? What probably you need to do is to get somebody to help you. We know that this decision making is not easy, but we have counselors who can guide you and hold you by the hands to make the right decision. Rather than, if you are 42 and you want to use your eggs, fine, I don't mind. It's possible. The chances are reduced, but it's possible. But if you are 50 and you want to use your eggs, the chances are almost zero. Because most of the time you are even reach menopause. That means we might even give you the drugs and you don't even produce any egg at all. You know, so that's like wasting the money. But if you still want to do that, you want to try, you can always try, but it's the responsibility of a doctor, a good doctor, to tell you the implication of the decision you want to take. Okay, this is also, okay, I'll take this because this is my love. Can someone with endometriosis go for IVF? And the answer is yes. I say it's my love because endometriosis is my comfort zone. So, yeah, so yes, endometriosis, someone with endometriosis can go for IVF. And we are having an international webinar on that on the 3rd and 10th of October, where we'll be talking about all aspects of endometriosis, including people who can do IVF and people who cannot do IVF. Can endometrial scratching increase the success rate in IVF? Well, That's $1 million question, because endometrial scratching, I don't know, this person must be, is the same person who asked me whether endometriosis can, someone with endometriosis can go for IVF. So this person must be somebody who is doing IVF. When endometrial scratching first came, we believed that it was going to revolutionize the result of IVF. You know, even the people who first spoke about it said it increases success rate by about 50%. And that was the initial thought. But now it's been with us for quite a number of years, and we have a lot of evidence now. And right now, we're not so sure about whether it can increase. In theory, it makes a lot of sense. But as it translated to pregnancies, no evidence to show that. But some clinics still do it because it's not harmful. So maybe you can try it. I'm not against it, but I'm also not for it, because we don't know whether, because there was a time that we did a webinar on repeated implantation failure, and I remember one of the doctors from the UK debunked most of these things that people were saying will increase pregnancy rate. And one of the participants had to ask her, tell me, now that you have debunked everything, that nothing increases pregnancy, tell me which one increases pregnancy rate. And sometimes that's what it is. We are scientists, and most of the decisions that we make is based on evidence. But sometimes we're not too sure. And we say, okay, fine, you can do it, but we're not assuring you of anything, but you can do it, especially when it's not harmful. I think for me, that's where endometrial scratching belongs to. So, somebody says I should repeat the email, info@abayomiajayi.com.ng. info@abayomiajayi.com.ng. So that's it. I think at this point, Hajia, I think we've had a wonderful evening. It's so much fun having you around. When the corona is tired of us and it goes away, I'm sure we'll be able to do something that we can gather under one roof and then do a program that will be beneficial to everybody. Thank you so much for being part of this.
Thank you, sir.
And
thank you so much.
Yeah. I also like to thank all the people that tuned in and the people who ask questions. Don't worry, your questions will be attended to. And then please, we'll see you again at the end of the month of October. So please keep fit, and do not forget, coronavirus has not left us. Please continue to maintain social distancing and use your mask. Keep safe. See you some other time. Thank you very much.
Thank you, sir, and have a nice day, everybody. Bye.
Yeah, you're